I want you to picture this. You wake up groggy, shuffle toward the kitchen, maybe rub your eyes and stretch, but then you notice something feels off. Your face seems numb, or maybe your arm feels weak, or the words you're trying to speak don't come out the way you expect. Most people would shrug it off as a bad night's sleep or stiffness, but as a brain doctor, I can tell you that some of these subtle changes are anything but harmless. The morning hours are the most dangerous time of day for stroke risk, and there are 8 specific warning signs you should never ignore. They can show up suddenly when you first wake up, and they can mean your brain is in serious trouble. If you or someone you love ever notices these symptoms, acting fast could be the difference between recovery and lifelong disability. Let's walk through them carefully so you know exactly what to look for. The first warning sign is sudden numbness or weakness, especially on one side of the body. Imagine rolling out of bed, reaching for your toothbrush, and realizing your arm won't cooperate or your face droops in the mirror. People often tell themselves, maybe I slept on it wrong, maybe it's just pins and needles. But when weakness or numbness appears suddenly, and especially if it affects just one side, that's a classic stroke red flag. It means blood flow too. The brain may already be blocked. That's not stiffness. That's not something to sleep off. That's the time to call emergency services immediately, because minutes really do matter. Every minute lost means brain tissue dying, and the sooner doctors intervene, the more function we can save. The second warning sign is sudden confusion or trouble speaking. Picture waking up and trying to ask your spouse a simple question, but the words get tangled on your tongue. Or worse, the sounds don't make sense even to your own ears. Sometimes people find themselves struggling to understand what's being said to them, as if the words around them suddenly turned foreign. Those are classic symptoms of the brain's language centers being affected by a stroke. If speech is slurred, sentences don't come out right, or comprehension is suddenly difficult, that's not grogginess, and that's not aging. That's an emergency. Too many patients dismiss it as fatigue, and hours later they're in the hospital with severe damage that could have been prevented if they'd called 911 right away. The third sign is sudden trouble seeing. Maybe your vision seems blurry, doubled, or you lose sight in one eye altogether. These changes can be terrifying, but what makes them tricky is that they can come and go quickly. People sometimes say, I thought it was just my glasses, or maybe I was still half asleep. But sudden vision loss or changes right after waking can mean a clot or bleed is affecting the part of the brain that controls vision, or even the retina itself. Any sudden visual disturbance is a red flag that needs urgent attention. Don't wait for it to pass or clear up on its own. By then, it may be too late. The fourth sign is a sudden severe headache unlike any you've ever had before. Morning headaches are not unusual, but when a headache strikes suddenly, feels explosive, or is accompanied by nausea, vomiting, or neck stiffness, it can point to a hemorrhagic stroke or another serious brain event. Patients often tell me they thought it was a migraine or sinus pressure, but if the pain is sudden, extreme, and unusual, don't gamble. Get medical help immediately. The difference between a harmless tension headache and a brain bleed can be subtle, but the consequences of waiting are devastating. The fifth sign is dizziness, trouble walking, or loss of balance. If you get out of bed and feel like the room is spinning, or you can't coordinate your steps, or your body leans to one side, that's not something to dismiss as morning clumsiness. It could mean the stroke has hit the brainstem or cerebellum, the areas that control coordination and balance. Some patients describe it as feeling drunk without touching alcohol, or as if the floor suddenly tilted beneath them. Those symptoms demand urgent evaluation. Even if they fade after a few minutes, they may be the early warning of a larger, more damaging stroke on the horizon. The sixth sign is an unusually high blood pressure reading in the morning. It's normal for blood pressure to rise as you wake up, but a big morning surge, especially if it keeps happening day after day, places huge stress on the blood vessels in your brain. That morning rise is one of the reasons strokes and heart attacks tend to cluster in the early hours of the day. If you're checking your blood pressure at home and notice it's consistently spiking in the morning, even though you take your medications, that's not something to ignore. Bring that log to your doctor. Adjusting the timing or type of medication could save you from a catastrophic event. High morning blood pressure is like a silent warning alarm. Take it seriously. The seventh sign is new or sudden palpitations when you wake. If you feel your heart racing, skipping beats, or thumping irregularly, especially in the morning, It could be atrial fibrillation, also called AFib. This heart rhythm problem may come and go, and many people don't even feel it when it happens. But it dramatically raises stroke risk because it allows blood clots to form in the heart that can travel straight to the brain. What makes AFib dangerous is that it doesn't always cause chest pain or obvious distress. Sometimes it's just a strange flutter when you first wake up, but that flutter can be a stroke waiting to happen. If you notice irregular beats, talk with your doctor about getting an EKG or wearing a heart monitor. Catching AFib early is one of the most powerful ways to prevent a stroke. The eighth and final sign is loud new snoring, choking or gasping at night, followed by morning headaches or persistent fatigue. These are hallmarks of sleep apnea, a condition where your airway repeatedly closes during sleep. Every time that happens, oxygen drops, blood pressure surges, and inflammation rises. Over months and years, those nightly stress cycles add up, and stroke risk climbs dramatically. Many people laugh off snoring or daytime tiredness, but untreated sleep apnea is no joke. If your partner notices pauses in your breathing, or if you always wake up groggy despite a full night in bed, get checked. Treating sleep apnea with a simple device can protect your brain and heart. Now, why do all these warning signs appear most often in the morning? It comes down to biology. As the body transitions from deep sleep to wakefulness, stress hormones, like cortisol surge, blood pressure spikes, and blood platelets become stickier. It's nature's way of jump-starting the system for a new day. But for someone with vulnerable arteries, that sudden shift can trigger a clot or vessel rupture. That's why mornings are prime time for strokes. Knowing this risk makes it even more important to recognize the symptoms quickly and not delay. So what should you do if you or someone you love notices any of these signs? Remember the word fast: face drooping, arm weakness, speech problems. Time to call emergency services. Don't wait. Don't lie back down hoping it gets better. Every minute of delay costs brain cells. Emergency teams can perform rapid imaging, give clot-busting medications, or even remove clots mechanically, but those treatments are only effective if you get to the hospital quickly. Once the damage is done, there's no turning back. Beyond responding in the moment, prevention is critical. Keep blood pressure under control. It's the single biggest risk factor for stroke. Manage heart rhythm issues like atrial fibrillation with medications or procedures as advised by your doctor. If you suspect sleep apnea, ask for a sleep study. Treating it doesn't just improve sleep, it reduces your risk of stroke and heart disease. And don't ignore brief warning episodes like sudden weakness, temporary vision loss, or short bursts of slurred speech. Those could be mini strokes, also called TIS, which are the body's way of saying a larger stroke is coming soon if nothing changes. Here are a few practical things you can do starting today. Keep a home blood pressure monitor and check your readings at different times of day, especially in the morning. Write them down and bring them to appointments. If you ever feel your heart racing or fluttering, try to take your pulse and note if it feels irregular, then mention it to your doctor. If your partner complains about your snoring or if you wake up choking, don't brush it off. That information could save your life. And most importantly, if sudden weakness, vision changes, confusion, or dizziness hit you in the morning, treat it as an emergency, not an inconvenience. I've seen patients who ignored these morning signals, hoping they'd fade. By the time they sought care, the damage was permanent. But I've also seen patients who recognized the signs, called right away, and walked out of the hospital days later with no lasting deficits. The difference was awareness and action. These 8 morning warning signs are not just random annoyances. They're your body's way of telling you that something serious is happening. If you learn them and share them with your loved ones, you could save a life. If you found this helpful, share it with a parent, a grandparent, or a friend. Stroke is one of the leading causes of disability worldwide, but quick recognition and action can change everything. And remember, this information is not a substitute for medical advice. If you suspect a stroke, call emergency services immediately. Time lost is brain lost. Take care of yourself, watch for the signs, and don't wait until it's too late.